All right, knee injuries can be pretty scary, especially when they require surgery. But luckily, Jacksonville Orthopaedic Institute has a host of doctors who can help. And we actually have Dr. Stanton Longenecker. He's an orthopedic surgeon. He's here with us today. Hello.
Good morning.
How's it doing? How's it going, Doc? You got your model right there of a knee here, and you're talking about the Macy prosthetic, or what is it?
Macy. Macy is the next generation of what used to be autologous cartilage implantation, ACI. So they added M in front because it's matrix assisted.
Matrix assisted, what's that?
Matrix means that the cells that actually implant are put into a membrane, which I can then bring out in size and put into a defect inside the knee, glue it in place, and it's all over in less than an hour. An operation that used to take me 3 and 4 hours to do is now done in less than an hour.
Wow.
And the recovery from that is in 4 to 6 months versus a year to a year and a half. So it really speeds up all aspects of care.
No doubt.
This is defects that are contained, however. We're not talking about osteoarthritis where we break down, we get a new knee replacement like me. This is one where you go in, you have a hole, like a pothole in the street, and we're going to fill it back in with cells taken from the body and put back into the body. But taken from 150,000 cells that we harvest, and then 30, 40 million cells put back into that knee, and they grow. It's like growing a baby in the uterus, except it's in the knee.
Wow.
That's
it goes
amazing.
through the exact same characteristics that a baby cells go through as it comes up in the womb. Looks just like that underneath, and then eventually it becomes normal cartilage.
So basically you can use the body to create more body.
Exactly.
Yeah, okay, well, so where did Macy come from?
Macy came from Lars Peterson. Lars Peterson years ago was losing Olympic athletes to holes like this in the end of the bone, and he figured out how to grow cells in cartilage, grow cartilage cells in solution, and then transplant them back into the knee. He was the first person to have done that. And that was 25 plus years ago. And
before, how long? So that's 25 years, but before that, what was the process like?
You lose the athlete forever.
Wow. So this has changed. This is absolutely changing, and that's why people keep seeing, like, for so many different injuries, the advancements in medicine are allowing athletes who Tommy John surgery, other things. This is basically what's next from this? What's the next step?
Good Lord knows. Maybe we'll grow the whole knee. But you know, for me, to do that operation in less than an hour is phenomenal. When I used to spend half a day doing it.
How long has that been, from doing it from half a day to an hour? How long have you been doing it for?
I've been doing it for over 20 years.
20 years?
I've done about 400 of these implantations over the years. But this is the one that really changed it for everybody, because it's so easy to do compared to what we used to have to do.
So who out there listening with a knee injury, what type of knee injury do you need for them to be like, hey, you know what, I need to call JOI and look into Macy?
This injury will cause swelling. It'll be usually related to some form of traumatic event that happened and caused this cartilage to delaminate, pop free. They get told there's not much I could do, or maybe they're being told they needed a I'm blocking on the name of the procedure, where they go in and just stimulate the cells by cracking on the bone.
Okay.
And that just has never worked out. This stuff works.
So there's been a bunch of advancements here done medically. What other, you were telling us about a different advancement that's happened as well, right?
There's some cool stuff that just came out this week, and I brought the brochure.
This is the new.
This is the new.
It's actually not new. It's been around for a while, but it's
new to us.
It's new to you guys, but it has not been authorized by insurance companies, so we couldn't use it. This is a molecule that was developed by some folks, and they embed cortisone into this molecule so that when you inject it into a knee, it slowly releases that cortisone over time. The beauty of that is, in diabetics particularly, cortisone runs their blood sugar sky high, and that of course has the risk of hurting kidneys, eyes, and actually causing people to lose toes and such like. But by not raising their blood sugar, it makes this useful for diabetics and for people that want a sustained long-acting cortisone. This is the ticket.
Because it used to be just cortisone goes in, the knee or the joint takes as much as it can, the rest goes through your body. Now this is like a time-release capsule.
Right, so that the amount that's getting out at any given time is not great enough to cause a problem.
That's great.
It's awesome.
Good stuff, Doc.
Been waiting on this stuff for over a year.
As I always say, Doc, I love what you guys do. I hope I never have to see you.
Yeah. Exactly.
I'm there for you. I'm there for you.
Well, thank you so much for spending some time and bringing out all your models and talking to us about this today. And a special thanks to the Jacksonville Orthopaedic Institute for sponsoring this segment. For more information, you can log on to their website, which is joi.net, or you can simply give them a call at JOI 2000. That's 564-2000.